Hi, this is Adam Biek from A.J.B Counseling and Psychotherapy, a private practice located in Manhattan. In this presentation, I'm going to give you a very thorough explanation of how we go about getting rid of your panic attacks. Um, so get ready, this is going to be lengthy. I'm estimating that it's going to be closing in on at least 40 minutes. Feel free to skip around. Hopefully you won't lose out on too much information. If you do, I will probably leave timestamps for what kind of information I'm covering during which part of the video, so you find it easier to get the information that you want if you need to do it quickly. Let's just jump into it. In this video, I'm going to cover, well, what is a panic disorder? I'm also going to talk about medication use. Medication is oftentimes, whenever I have clients coming in with a panic disorder, oftentimes they're already on medication, so it's an important aspect of treatment. And we can treat panic attacks or panic disorder with medication or without. It looks different in both situations. There are also advantages to being on medication, but there are also advantages to not being on medication. And we'll get into that. And then lastly, we'll talk about how do we actually get rid of panic attacks? So if you're on medication, for example, you can control your panic attacks. The problem is that in most cases, when you stop taking medication, your panic attacks will return. So no matter what we do, most of us will still have to do some kind of behavioral psychotherapeutic type of stuff in order to get rid of panic attacks. So we'll get into what that psychotherapeutic stuff is. So let's jump into this now. What is a panic disorder? Well, let's start with what's the difference between a panic attack and a panic disorder. Panic attacks are actually very common. It happens in about half of the people you meet. 50% of the population will experience a panic attack at one point or another. However, a panic disorder is a little different. Panic attacks oftentimes occur as a product of either a phobia, so you are terrified of something out there in the world, snakes, rats, I don't know, spiders, right? And if your fear is severe enough, it can cause a panic attack. Or more commonly, when people have a panic disorder in New York City, more commonly, it's the subway. The subway terrifies people to the point of causing a panic attack. That still falls more in the category of a phobia. A panic disorder is actually a lot more rare. It happens between 2.5% to 5% of the population, depending on the study and depending on the age groups. And the defining feature of a panic disorder is that people oftentimes can't quite tell when it's going to hit them and what's causing them. That's really the defining feature of panic disorder. And also the panic attacks are recurring over and over again, and they seem to be random. So that's really a panic disorder, and that's the difference between panic attacks and a panic disorder. Panic disorder is composed of many unpredictable panic attacks. Some common complaints and symptoms of a panic disorder. Well, the main symptom and complaint is massive fear. That's really the most, that's as over all-encompassing as we can really get, because if we start getting into the physical symptoms, yes, there are still commonalities, but when it comes to the physical symptoms, we're going to see a lot more variety too. And the reason is that the symptoms, they may be limited only by our imagination. So if we can imagine something, it can happen. Also, different people express stress and anxiety in different ways in their bodies, so this can vary. However, we can talk about some of the most common ones, and we will in a little bit. But first, let me start with how we can break down the panic disorder. So panic disorder can be broken down into three groups, very broadly speaking. About 30% of people who have a panic disorder could be considered to be a part of the high cognitive group. They have, that means that their panic disorder is not just fueled by conditioned responses, so like learning, right? You learn to react a specific way to certain things that are happening within your body. You might be noticing that I'm making a lot of references to the body. That's because panic disorder is largely tied to our experience in the body. If that doesn't make sense to you right now, Just hang on. I will explain it more later. But panic disorder is really strongly tied to internal triggers or internal cues. So if, for example, a phobia, for example, the fear of the subway or fear of rats or fear of spiders, those are external triggers or external cues, things outside of ourselves that are causing our panic attacks, right? Panic disorder is mostly fueled by internal triggers and internal cues, which is part of the reason why it's so unpredictable. But it's only unpredictable because we're not tuned into what's really happening for ourselves at any given moment. And we'll get into all of that in a sec. Um, high cognitive groups, so the people, 30% of people who have panic disorder have a high cognitive component. That means that it's a conditioned response and also worst fears. Thoughts about the worst case scenarios pop up for them and fuel the panic. Another 30% is the low cognitive group. That means that these individuals are mostly reacting to conditioned responses, and for one reason or another, they don't really have a lot of their worst fears popping up for them. And more than likely, for these individuals, the panic disorder is just a fear of having to experience another panic attack, which is enough to fuel a panic attack. And then the remaining 40% is a mixed bag. These individuals don't neatly fall into either the high cognitive or the low cognitive group. Some common physical symptoms these are all symptoms related to the fight or flight response. So trembling, sweating, feeling dizzy, and also sensations. So sensations, again, bodily sensations, we're going to come back to this. This is very important. Sensations around the face, eyes, stomach, chest, throat. Also feeling like a person can't breathe, but that's more of a constellation of symptoms than it is really a specific symptoms. We'll again get into that a little bit later. So I mentioned that there's the high cognitive group. These are individuals who have their panic disorder is not just a product of a conditioned response, but also of their worst fears popping up for them. So some common worst fears could be the fear of death, right? Or the loss of an important aspect of their lives. So all of these fears, the worst fears, they all fall in the broad category of existential fears. So these are fears tied to our existence. Most commonly, it's very straightforward. It's a life or death kind of a fear. For example, people oftentimes feel like they might suffocate to death, they might have a heart attack, or they might lose control over their own behavior. However, it doesn't have to be that. For example, if there's a mother who has panic disorder, she might have her worst fears might be related to her motherhood. If, for example, you have a professional, or someone who is really well established in their career and they derive a large sense of self-worth and purpose from that career, their worst fears might revolve around that career, so losing that career or something along those lines. I also mentioned that panic attacks can be triggered by external triggers or internal triggers. We'll get into that a little bit more as we go along, but as a reminder, people with panic disorder may have external triggers, but they will definitely have internal triggers. And the internal trigger is the culprit behind the out of the blue phenomenon. It's that common thing that people with panic disorder say. It's like, I don't know when it's going to hit me. It seems to come at me out of the blue. All right. Can you get rid of panic disorder? Yes, absolutely you can. You can go back to living the way you were before your panic disorder started. It takes a little bit of work and a little bit of time, but you can get there. How? So if I was to summarize everything that I'm going to be talking about in this video into a single sentence, I would have to say something along what you see on your screen right now, which is by understanding exactly how it maintains itself and interrupting its cycle or interrupting its life cycle. So a simple way of conceptualizing a panic disorder is to think of it almost like an infection. You get infected by something, and that something needs to feed, right? So it's like a parasite. It infects you like a parasite, and it needs to feed off of you. What it feeds off of is your fear. So one way to get rid of panic disorder is to cut cut off cut it off from its source of food, which is fear. And that's exactly what our treatment is about. It's once we get rid of the fear response, once we stop reacting to everything that our panic disorder is throwing at us, that's when it's going to start starving to death. And that's exactly how we get rid of panic disorder. There's other ways, fancier ways of conceptualizing panic disorder, by the way, and we'll get into that in a second as well. Um, but before we get into the whole treatment and everything, let me talk about medication, because medication is oftentimes a very it's something that oftentimes comes up in treatment for various reasons. One of the big reasons is that oftentimes when I see patients, they are already on medication for panic attacks. Um, but before I get into that, let me give you a disclaimer. I am a psychotherapist, not a psychiatrist. The reason why I have to give you that disclaimer is that medication is not my specialty. I don't deal with medication. A psychiatrist deals with medication. I deal with the behavioral work, the actual work of getting rid of your panic attacks, while a psychiatrist deals with medication. So I have to give that disclaimer, but I've been around this field long enough. I've worked with enough panic disorder cases. I've read enough about panic disorder cases to be able to talk to some degree about medication and offer some guidance here. So, out of all the medications that are available, there is one medication that stands out as most likely the best course of treatment in general. And, which medication is good for you will vary based on your history and your health and things like that. So you definitely need to consult with a psychiatrist. However, I can tell you that generally speaking, SSRIs, which are selective serotonin reuptake inhibitors, it's a class of antidepressants. Those are the best for panic attacks. They do take a while to kick in. They can take a little bit over a month for them to start working, and you do need to be on the highest doses, typically way higher than what you would normally use for depression, for them to be effective, but they are effective. Generally speaking, you want to avoid something called SNRIs, that's serotonin and norepinephrine reuptake inhibitors. The reason why you generally want to avoid these drugs is because they work on a part of your body that is responsible for arousal. So norepinephrine is a precursor to epinephrine, adrenaline, and it works on that aspect of your body. So doctors will sometimes, if they see depression is part of the presentation for someone who's coming for help, they might oftentimes prescribe things like Wellbutrin in order to give the person more energy to pull them out of depression. However, if the depression is caused by panic disorder, that's not a good move. So there is something, there's very often people with a panic disorder will develop secondary depression. And I'll get into that in a second. Let me finish my whole spiel on the medication. But there is something called secondary depression that can develop as a result of having to deal with panic disorder. And maybe sometimes doctors see that and they figure, let me treat the depression first, right? But that's a problem. So, if you are on Wellbutrin and you have panic attacks, perhaps you might want to consider switching to something else. Perhaps you might want to speak with your prescriber to figure this out. So there's a third class of drugs, benzodiazepines, and those I have to tell you to be very cautious about. So benzodiazepines are like Xanax or Klonopin, and they are very effective and work very quickly within minutes, but they carry a very high risk of substance dependence. They are habit forming. They are psychologically addicting and they are physically addicting. So these drugs, I generally say, stay away from. Something like 61% of people with a panic disorder develop psychological dependence on these drugs, which is not good. It introduces a new source of anxiety. Substance dependence, generally speaking, comes with anxiety. It's just once you become dependent on a substance, your anxiety is automatically going to increase, because the way dependence works, it's kind of like a vicious cycle. I'm not going to get into explaining exactly how it works, but that is the problem, that it's going to make your situation worse in the long run. They're best used on a very short-term basis. So if you're going to use them, typically you want to use them while waiting for your SSRIs to kick in. So remember, SSRIs can take over a month to start working. So oftentimes doctors will prescribe benzodiazepines to hold the person over to manage their panic attacks while waiting for SSRIs to kick in. So that's the only way I would ever recommend using these drugs, the benzodiazepines, on a very short-term basis. And after that, once the SSRIs take over, these things should not be even part of the picture. Um, so when do we want to use medication? We want to use medication if a person develops, so if you're dealing with panic disorders, with a panic disorder, if you develop secondary depression and hopelessness, that's when we want to introduce medication. The reason is that hopelessness or depression can really get in the way of making progress in treatment. Sometimes panic disorder can wear us down to a point where we just lose all hope. When we lose all hope, we don't really, it's very much harder to take action. It's much harder to take risks, to take action. We don't have that fighting spirit. So we would then go on medication, get rid of panic attacks with medication temporarily while waiting for our will to fight to come back. That's really the whole point of medication. That's how medication fits into the overall treatment. We're using it to restore the will to fight. Now, generally speaking, we want to avoid using any kinds of medication because if the moment we introduce medication, treatment time, overall, the entire treatment time is going to increase by a lot. So let me give you an idea of what we're talking about. So in best case scenario, if a client comes to me with a panic disorder and everything gets off to a good start, they're not hopeless. They came to me for help early enough since the panic disorder started. We can be almost done. In best case scenarios, we can be pretty much done with treatment within 3 months' time. If a person's on medication, however, we're easily talking at least a year. Why? You might ask, why does medication make it so much longer? Couple of reasons. Mainly is because if medication gets rid of your panic attacks, then we can't work on your panic attacks. If you don't have panic attacks, we can't work on your panic attacks. That's basically what it boils down to. You need to have at least some symptoms for us to make progress. Because what we're really learning is how to deal with those symptoms so that they're no longer setting off our panic in the future. But there is a benefit. There is a benefit of being on medication and then slowly coming off of that medication. The benefit of being on medication, I think a lot of people would find this much more, what's the word I'm looking for? Digestible, I guess, more palatable to do it this way. So when you're on medication and you've reached a level of stability where you don't have panic attacks and you feel ready to start challenging yourself on how to deal with panic attacks, then we can introduce panic symptoms in a small way, right? We don't have to have you facing the full-blown panic because we can taper down the medication, the dosage that you're on, of course, with the help of your prescriber, slowly. We can cut your dosage slowly, which results in your panic symptoms coming back slowly. It's sort of like playing a computer game on easy difficulty. So first we set you off, we drop the dosage a little bit, which means that you start playing the game on easy difficulty. Once you master the game on easy difficulty, we drop the dosage a little more, which now you're playing the game on medium mode, and so on and so forth until we reach hard mode, until you're free of medication and eventually free of panic attacks. So that's the nice advantage of being on medication and then tapering down. Okay, now let's talk about the psychotherapeutic interventions. So there are, generally speaking, two types of interventions. We have desensitization and we have acceptance. So remember how I spoke earlier about, where? Here. Remember how I spoke about the 30% have high cognitive component and then another 30% has the low cognitive component, right? So these different groups, in some sense, correspond to the two different intervention types we're going to be using. So the high cognitive component has a worst fear part, right? While the low cognitive component is mostly conditioned response. The high cognitive component has a conditioned response and worst fears, while the low cognitive component has mostly conditioned responses. So one of the interventions that we'll be using, which is desensitization, is going to address mostly the low cognitive components. So it's going to address the conditioned responses, as well as the conditioned responses of the people in the high cognitive group. The other intervention, the acceptance component, is mostly geared at the high cognitive group, which is the worst fear stuff. So desensitization gets rid of conditioned responses, and acceptance gets rid of the worst fear problem. Okay, so that's why we have these two interventions. So if you're actually in the low cognition group, you may be it may be enough to just use desensitization. If you're in the high cognition group, you will need desensitization and then also the acceptance component. So let's break down desensitization a little bit. So desensitization, we can desensitize to external cues, so like phobias, so right, the spider, the fear of rats, fear of whatever, or in the case, most commonly in the case of panic disorder, fear of New York subways. We can do that by using traditional exposure techniques. They're easy peasy. I don't even want to get into it at length here. It's literally all about baby steps. You just take baby steps towards your goal until your anxiety isn't an issue. So you take a little step closer towards the thing that terrifies you, and then you just wait. You wait until you relax. You take another step. You wait until you relax. This is literally the entire process until you get rid of your fear entirely. Easy, easy stuff. Now, but the biggest problem, this isn't really that big of a deal. Most therapists can deal with this, and this is not an issue, this external cue stuff. The bigger problem, the bigger challenge are the internal cues, this stuff right here. That's the central theme of panic disorder. This is the source of why a lot of times people feel like that panic is hitting them out of the blue. So some obvious examples of internal cues or internal triggers are chest pain, narrowing, blurring vision, throat and breathing related sensations. So with chest pain, oftentimes people might have the worst fear that I'm going to have a heart attack. With narrowing, blurring vision, the worst fear could be I'm going to pass out, I'm going to lose consciousness. And with a throat and breathing problem, oftentimes people will think that they might suffocate. However, that doesn't have to be the case, right? So these are obvious examples. You can have subtler bodily examples. So you could have a mild tension that makes you feel off. And these are oftentimes harder to spot. So one reason why sometimes people can't quite tell what is the relationship between what they're experiencing, and one reason why people can't tell what's causing their panic attacks is because a lot of times people who develop panic disorder have a elevated anxiety levels on a constant basis, on a daily basis. And whenever we're anxious or whenever we're worked up, our body gets revved up. Our body naturally adjusts to it, responds to stress by, increasing muscle tension so that you're ready to fight or flee, raising your heart rate, things like that. So if that's you on a constant basis, that just becomes your background noise. Do you know what I mean? It becomes your background noise the same way that music can sometimes become background noise. Like, do you remember the last time, perhaps you can relate to this, maybe you had some music playing in the background, but you were working on something and you completely lost track or lost awareness that there's music playing in the background. Or maybe you're out there in public, there's a lot of people talking, but you tune everybody out and you can only hear the friend that you're talking to. This is what I'm talking about. The background noise gets tuned out. The same thing happens with anxiety. If we're constantly walking around with anxiety, the tensions that we experience get tuned out. And these tensions that get tuned out are actually, we're still responding to them in a conditioned way, but we're just not aware of them. So that's one way that people one cause of why people feel like panic attacks hit them out of the blue. It's just the triggers actually get drowned out because they're almost always there. Another reason is that fear generally discourages us from sticking around and checking things out. When we feel afraid, we're more apt to run. So, so asking someone with a panic disorder to look around, just like check out what's really happening for them that's causing the panic. It's kind of like asking them to stop and smell the roses in a war zone, because a panic attack can very much feel like that. It's like everything's dangerous, everything's terrifying, everything is terror, and all we're really interested in is getting away from that terror, getting away from whatever's causing that terror. Unfortunately, with panic disorder or panic attacks, we can't really get away from it. But we're so busy trying to that we never really pause to take a look at what's causing our fear, our panic. So that's why it can also be difficult to notice what's really causing our panic attack. It's like asking someone to stop and smell the roses in the middle of a war zone. Um, Now, so I mentioned again, before that we have the 30% of people with panic disorder have the high cognitive component. So I'll give you some examples of thought that people will often have is, I hope I don't get a panic attack during the work meeting. Oftentimes this thought leads to a panic attack. But similarly to when people feel some sensation in their chest and they'll say to themselves, oh, I hope it's not a heart attack, right? That's also going to likely lead to a panic attack. These are all internal cues or internal triggers. Now, there could be a subtler cognitive example, or a subtler thought that can eventually lead to a panic attack. And it could be as innocuous as, I better hurry or I'll be late. So, we all sometimes run late in the morning, and suddenly we have to hustle. We have to kick it into the next gear. And naturally, we're going to get a little bit more tense so that, we wake up because we're taking this issue seriously. We're really trying not to be late. But what that does is that it starts the cascade of tensions, of internal tensions that are associated with panic attacks. And that's when the conditioned response takes over. We'll get into better details, better examples a little later. Okay, so now that kind of wraps up the idea behind desensitization. Now let's talk about acceptance. So acceptance, what are we accepting? Right? It's kind of in the name. We're accepting something. What are we accepting? We're accepting the fact that life is not in our control. Well, I'm not saying all of our lives, but certain aspects of our lives are not in our control. That's a huge part of anxiety for a lot of people. Not just anxiety, but if we are trying to exert control over life too much, right? Over attachment, being overly attached, over controlling, then we can actually develop panic attacks, right? Another way to look at the reason why we even have a panic disorder in the first place is to say that it is the product of over-attachment, or it's the product of being over-controlling. So there's certain things in life that we cannot control. For example, if you are about to have a heart attack right then and like right now, you can't control that. Unless your doctor gave you a procedure and told you to take something to stop it, then yes, you got certain things to do. But if life has its own rules, and there's only so much that we can do, right? Same thing with suffocation. If we're magically going to suffocate with the moment we get on an elevator, there's nothing that we can do, right? What else? What are some examples of crossing the street? We can try to protect ourselves, right? We can check, we can look left, we can look right. But ultimately, if we had failed to notice something, and we end up getting hit by a car, then we get hit by a car. People get hit by cars all the time, yet they check. It's just we can't control everything. You can look left, but the moment you look right, some car ends up speeding from your left side and something bad happens. So we only have so much control over our lives. And the more control we try to exert, the more likely we are to end up with A, high anxiety, and B, if the attempt at control is too high, it's unhealthy, and an unhealthy level of attachment, we can actually develop panic disorder. So as awful as that sounds, as what I'm about to say, as awful as that sounds, and perhaps there's a better way that I could phrase this, and there probably is. A lot of the fears that we have are about life and death, right? So when we're having a panic disorder, and assuming that you are in the high cognitive group, you'll have fears along the lines of, I hope I don't die from a heart attack, I hope I don't suffocate, I hope I don't lose my mind and lose control over my own behavior, right? And do something stupid. Those are all common fears. What this tells us, though, is the presence of these fears and the fact that these fears actually cause a severe fear response, a severe panic attack. This is telling us that that person is too attached to the idea of maintaining control of when and if they're going to get a heart attack. That's something, unfortunately, that's largely out of our control. Like I don't want to get into, I'm assuming that some of you, whoever's listening to this, might have panic attacks. So I don't want to get into the details of it now because I also imagine that it can be it might be stressful for me to talk about this at length. So I'm not going to get into the details, and I'm just going to assume that you kind of get what I'm getting at. That there's just we're trying to control something that's actually generally out of our control. So yeah, let me just end it here. I don't want to set off panic attacks for people by discussing this at greater length. But that's the whole idea of acceptance. We're trying to move a person into a more accepting, into a more detached place so that panic doesn't get set off anymore. This is actually the most powerful thing you can do for yourself. Acceptance is it's almost bordering on magical. When I witness this during session, I mean, I will see people go from terror to suddenly, even though they just had a panic attack, when they can pull off acceptance, their panic attack ends right then and there, and their face changes. I can see it in their face. Their face starts saying to me that almost like a sigh of relief, like, oh my God, I see the light, kind of a thing. Wow, I see how panic attacks are going to end. It's like that one experience of acceptance, that moment when they accept a lack of control, is the moment they fully understand how powerful this is, and they see very clearly how the value of letting go of control, the freedom, the liberation that comes from it. Um, okay, we'll get into. Okay, yeah, we're gonna get into it here now about how does this stuff work. So, desensitization. How do we actually desensitize to the internal cues? I recommend doing that using Gestalt-based interventions, which are experiential in nature, meaning that during the session, the therapist will walk you through like a guided mindfulness exercise that will help you in a non-judgmental way observe your experience from moment to moment. This is where Gestalt really shines. It shines in its ability to help people explore and stay with each moment and move from moment to moment. And if there's a resistance to switching, to transitioning from moment to moment, Gestalt is well built around guiding us to observe that resistance. It's wonderful for helping people to experience each moment in a non-judgmental way, which is exactly what we need in order to desensitize ourselves to our internal cues. Um, so this is meant to address if you're in the low cognition group, this alone should be enough to help you. If you're in the high cognition group, you're going to have to do the Gestalt-based interventions and also work on acceptance. So how do we do the acceptance thing? So in the Gestalt-based interventions, we actually do have a built-in example that your therapist would do to demonstrate what it feels like to let go of control. So pretty much everybody, I have not seen a case where a person this doesn't happen to. Pretty much everybody resists certain kinds of experiences in their bodies. And more often than not, a therapist will be able to, during the session, to guide you into letting go of that resistance. That little experience is like a taste of what it's going to take to let go of your worst fears, to let go of trying to control your worst fears. But that's just a part of it. So we'll be building off of that little experience, so that you have an idea of what it's like to let go of control. But then we're also going to be building an understanding of exactly how your panic functions, and we're going to be building your understanding of the way your panic functions to such a degree that you trust it. I mean, there is nothing left to discover. That's how much we want you to be familiar with how your panic functions. In the end, there is going to be, more than likely, it's still going to feel like a leap of faith to let go of control, because letting go of control is not something that we want to do by any means. So you may still feel like you have to take a leap of faith to let go of control. Like some of the stuff I was saying, like letting go of control, of trying to control whether you're going to have a heart attack or not. For most people, this is an absurd idea. How can I let go of control of whether I'm going to have a heart attack or not? That seems stupid, right? Like I should do everything I can to stop a heart attack. And I agree. I agree fully. However, most of us end up going far above and beyond in attempting to control. We go beyond what we can actually control and try to control the things that we cannot control. That's where the problem is. And I feel like I should have clarified it earlier on when I started talking about it, but whatever. So that's really what we're talking about. We're talking about not controlling the things that we really can't control, and most of us do that. So initially, like right now, without really having a theoretical understanding or any kind of an understanding of how your panic functions, that leap of faith is going to seem much bigger. However, after you have a well-developed understanding of exactly how your panic functions, that leap of faith is going to be smaller. It's going to be easier to make. And the final step is making that leap of faith so that you can actually accept your panic attacks. So just that you can actually accept uh, your worst fears so that your panic attacks don't get set off anymore. Okay, so now let's get into some examples of how panic functions. So I want to give you an idea of the cycle of panic disorder. There's a cycle. Panic disorders tend to have a cycle like this right here. In red, you see that's a cycle. So it all can start, it's just examples, it can start in different ways for you, but let's just say this is how it starts for you. You have a thought, I hope I don't get a panic attack. That causes anticipatory anxiety, or anticipatory tension. You're anticipating a threat, right? So in the jungle, back in the days, if you hear rustling in the leaves, you're going to get a little tense, right? That's your anticipatory anxiety. You're preparing for a danger that might be lurking in the bushes. That leads to increased stress response, and then that leads to increased bodily tension or bodily symptoms. So here we have this right on his chest, this little guy. Let's just say it's a chest tension, right? That chest tension, he notices this chest tension and he says to himself, oh my God, is it a panic attack? That thought increases the stress response even further in anticipation of a panic attack. That increased stress response again leads to an increase in bodily tensions, the bodily symptoms, which makes this whole thing right here in his chest even worse. And then the next bubble might say, oh my God, it is a panic attack. And again, he gets stressed out, more tense. This gets worse. This just confirms the fear to him. And he's now convinced that he is having a panic attack, or maybe he's thinking that he's having a heart attack, and it just keeps going in circles like this. So he'll have an escalated tension here. He'll make a new interpretation of what's happening that's negative. That increases stress response, which increases the bodily tensions, increases the symptom. That increased symptom sensation confirms that his previous thought was correct, and the wave hits him again. Another stress wave hits him, and just keeps going in circles until he gets exhausted and panic ends, or he just kind of surrenders into the panic attack, which is another solution to panic attacks. So that's an example of the cycle of escalation. Here's another example, a little sneakier. So in this scenario, you wake up in the morning, or this guy wakes up in the morning and he says to himself, I better hurry or I'll be late. Causes a stress response, causes increased tension. So here we have, like, you can see they're a little bit more scattered because they're a little bit less, there's more subtle in this example. And he might say to himself, something feels off. What am I feeling? But this guy has been dealing with panic attacks for a while, so the first thought that's going to pop in his mind is, oh man, I hope it's not a panic attack. And we're back into that same cycle that we were here. We just entered that cycle. Increased stress response leads to increased bodily tensions, which worsens this tension in the body, and that just confirms to him that he has a panic attack. That causes, again, more stress response, more tensions, and we keep going in this cycle. We just keep on spinning here. Here's another way. Here's another way we can look at what's maintaining your panic disorder. So here in red, we have, basically, this is the fear of having a panic attack. So that's one way that panic disorder maintains itself. I hope I don't get a panic attack, right? It's a very common fear. Nobody likes having panic attacks, so this is a big source of fear. That leads to increased stress response. That's increased stress response, increases bodily tensions and other related experiences like trembling, sweating, which leads to the experience of a panic attack. And bam, you are in this cycle. You start saying to yourself, "Oh man, I'm having a panic. I hate this." Woof, another cycle. "Oh man, when is it going to go away?" Woof. "Oh man, I can't deal with it." Woof. Right. So it's over and over again. You're stuck in this cycle. Here we have these three examples on the right. So might have a heart attack, might lose control, might suffocate. These are examples of those worst fears. So this applies to the high cognitive group. Um, so for example, the heart issue, right, might have a heart attack. That boils down to increased tension in chest, which convinces that a heart attack is in fact happening. Oh, here's a interesting, let's call it a pro tip. It doesn't have to be tension in the chest. It can also be tension in your back, which radiates out to the front, or it just seems like it's in the front. Um, so yeah, but these are all tensions. And so, the same thing happens here. Some of the tension, first the person says to themselves, "I hope I don't have a heart attack." That causes increased tension. Then that convinces them that, "Uh-oh, maybe I am having a heart attack," and that increases another wave, or that causes another wave. Then the tension really escalates, and then they say to themselves, "Oh man, I think I might be having a heart attack," and they're in this cycle, panic cycle. Boop, boop, boop. Same thing here, same idea, just different symptoms, different interpretations. It's all about symptoms and interpretations of those symptoms. So in this case, so the idea behind losing control over your own behavior, or even losing your mind, that tends to be a product of just how overwhelming the amount of sensations we experience during a panic attack. So during a panic attack, so much of our body is feeling things that it can be overwhelming, and sometimes it can feel like it's nearly impossible to track it all happening. But if this is your fear, you'll find a lot of relief in just identifying exactly what you're feeling and where you're feeling it. Because this is oftentimes a product of just losing track of everything that we're feeling in the moment, because it can be so overwhelming. But the cycle is the same. The more intense the symptoms, the more numerous the symptoms, the more intense, the more convincing the idea is that we're losing control, losing our minds, and we're stuck in the cycle again. And then lastly, the suffocation thing, that's a product of chest and throat tensions combined with elevated heart rate and respiratory rates, which leads to the sensation that you're not getting enough air. And the more intense these symptoms are, the more convinced we are that this is in fact happening, and we get stuck in the cycle again. So how do we get rid of them? All right, so I introduced you to two interventions. I said desensitization is one intervention, and acceptance of lack of control is another intervention. The first example, the fear of having panic attacks, we get rid of mostly through desensitization. The lack of control can also be helpful, but it's mostly desensitization. The worst fears, however, we address through desensitization. So remember I mentioned that desensitization will introduce us to an idea of what it feels like to surrender, to let go of control, because there's a built-in exercise that usually is easy to pull off for most individuals. That's why desensitization does play a role. It also will decrease the intensity of the panic attacks as well. But the other half of the solution is going to be acceptance. So that's why you see it's color-coded. I'm crossing it out half with the green, which stands for desensitization, and half with the blue, which stands for acceptance of lack of control. So all of these will be gotten rid of like that. So that's what the solution looks like in a snapshot, I suppose, right? Let's talk about signs of improvement. So obviously one sign of improvement is that your panic attacks end sooner. Actually, I should have probably gone over this. Let me not, because I know this is already long, so let me not even bother with that. So let's talk about the signs of improvement. So one sign is that panic attacks are ending sooner. So, for example, you might only have to deal with the first wave, so to speak, of panic, or you might refer to it as terror at this point, no longer as a panic attack, because it presents itself differently. It no longer presents itself as a constant, like a recurring, refeeding, long-lasting thing. It's now just like a rush of adrenaline, a rush of massive fear, and then you already kind of like know what this is, and it just kind of trickles away, right? So that might be what you will be dealing with as you start seeing signs of improvement. The reason why this might happen for you is because the cycle, this right here, this cycle is weakened or non-existent, right? Is the product of, so panic attacks ending sooner is most likely the product of desensitization. Desensitization will be the primary reason for why this is happening. However, if this is your situation, then you may need to pursue the triggers of that first wave. So we might have to look whether it's a thought that's causing this, right? Some kind of interpretation, or is it a symptom that's just automatic, right? It's usually a mixture of both. But the solution to that first trigger is either going to be through acceptance or through desensitization. Another way, another sign of improvement is a successful interruption of panic attacks mid-panic attack. This is a knockout punch. Okay, so if this happens in treatment and you successfully interrupt the panic attack by accepting lack of control, that's the end. It's pretty much the end. This is a sign that very soon you're not going to be in therapy anymore, because it's hard to explain how liberating it is to have that experience. It's a very liberating experience for individuals when they're able to pull it off. It's not easy, but it can stop panic in its tracks like that. And after that, the experience is so powerful that you will pursue that experience over and over again every time panic crops up. And before you know it, you won't even have panic attacks anymore. So this is really this is an awesome thing when it does happen, and it's a very strong predictor that you're about to be done with treatment. Another sign of improvement, your panic attacks become less frequent. The reason why that happens is that you more than likely have gained a lot of confidence. You're no longer so trapped. You're not feeling trapped, so that's another sign of improvement. You're not feeling trapped. You're not feeling threatened by them. You're not as fazed by them. As a result, because panic is really self-feeding, you're not going to have panic attacks as often. So yeah, as I mentioned, you might feel less trapped. You might feel confident to continue this process outside of therapy on your own. So you might say, you know what, I think I got this from here on out. You know, that's a sign of improvement. That's a sign that you are well on your way out. And I fully support this. My philosophy is like, if you feel ready to go, then you go. And if you need to come back, you need to come back. That's no biggie, right? You can always come back. And then lastly, the biggest sign of improvement is obviously if you have no more panic attacks. So that's it for this presentation. Feel free to contact us with any questions. We're with a practice called A.J.B Counseling and Psychotherapy. We're located in Manhattan on 31st and 5th, and we have another office off of Grand Central. Feel free to check out our website, ajbcounseling.com. If you want to contact us, email us at info@ajbcounseling.com. And then lastly, you can call or text 347-460-6570. Thanks a lot, and I hope you enjoyed this video. I hope this was informative, and we'll see you in the next video.